think we should be live if you want to refresh that. Okay, we are live, right? So if you guys can just give me confirmation for the sound from your side, and I think Ethan is listening as well. All right, we are live. Today is June 18th, 2021. It's our Friday United Medical ACO sessions. We are here to discuss so many different, yep, I got the message, thank you. We are here to discuss different topics from COVID-19 as well as some healthcare related updates. We are gonna have a little bit, actually, I'm gonna try to demonstrate something for you guys, but before I do that, I need to close this messenger so then they don't send me messages on the PC. So let's do this. Okay, and so, all right, now, where is our PowerPoint? You know, when we do these events, it's always important to understand that this is always a teamwork. So today, Tanner is off, so we'll try to, I mean, he still did all the preparation work with me, but so I have different group of people helping me today, and our guests will be also from our leadership team, and hopefully we can address some of the issues, some of the questions together, and then we can give you some background on why we are always concerned on the healthcare expense increases, and also finding the reasons why this is happening. And if the public knows about these more, then we would be able to actually, I believe we will be able to do a better job from that point. Now, before I actually continue, if you can give me a second, and I just need to send the message to our groups. And there are two distributions group from WhatsApp, and I know from our Turkey office, they already send information, but let me just send it to our groups here. That's one, and then this is two. Okay, now I'm gonna start sharing my PowerPoint, and I will be, hopefully, I can give you some good insight on certain things that's happening today. One of the questions that I get is, why do we always bring politicians into our discussions? You'll find the answers in the next 30 minutes. We'll look at the vaccination stuff. And then from the United Medical side, I have two of my directors who are gonna join me. And then we'll be talking to them about different issues in healthcare, and also some updates from United Medical side. Now, this is from the vaccination side. This is important to know that right now, Delaware has 53% of the people age 16 and over, they have their vaccine completed. But for the country level, we are at, the goal that we have is getting to the 75%. Now, last week, you may remember what I did with the way that we demonstrate this with Tanner was, well, here is May 18th, about a month ago, we said, and when I say we said, I'm talking about what we are given. We said, well, it's going to take 4 months with that pace. And that was at 1.7 million that time. Now, 1 month later, we are saying it's going to take 5 months is because this number here is decreased. So now when in May, when we said, so from May, it's like June, July, August, September. So if we were saying that September, when we were going to be done with the 75% rate, right now it's 5 months from June. That's going to take us to November. So already 2 months, there's a delay. I think this is a good, easy math to explain why we have these concerns. Now, one new, actually, source of information that I want to share with you all is this website from arvoldata.org. So I actually was using this to show some of the vaccination stuff to our providers. Now I added a couple different regions, but because we have an office in Turkey, and because Turkey they did really well in the beginning, and then they didn't do well for the vaccination, and they went back to doing really good in the last couple of weeks. So I just wanted to demonstrate a couple of things for you. So let's just refresh. This is from last night, and I didn't refresh it yet. And as you can see, the data here is until June 16th. So let's see what happens when I refresh this. So let's see. Now we have one more day data here. So what I was doing is I took Europe, I took United States, and I took Turkey all together. So, and for those who are in these regions, I think it's important for us to know and be a good judge of what's been done. I think this is important. So United States, of course, we did very well with vaccination. Now, Europe started doing well after March. And so this is the, I don't know if John is already in, but I think this is what I was trying to say in our providers meeting last night. So there was a point in Turkey where that number actually, they started doing really well. I think they did 1.5 million doses last couple of days. And then this increase here is the indicator for that. So I believe in the next 4 or 5 business days, this is gonna exceed the Europe average. That's my estimation based on what's given for from today. Now, again, because this data is as of yesterday. Now, what's also interesting here is I'm able to go back between the from one day to the next, so you can kind of see where these changes are happening. So there was a big gap between United States and Europe, even like in April. Now that's closing, which is good. And then hopefully others are able to get to that level. Now, as you can see here, they are adding new data. So like it's a data for China added on June 10th. So it's not a perfect data, but it's a good way to look at the trend. Hopefully this is making it a little bit better. So, well, better to kind of understand. This is from the people vaccinated. When you look at the confirmed cases, and if we were to keep with the same countries, that's also the numbers there is not actually yet showing us the impact, but I think when we look at this in the next 2-3 weeks, we'll probably see the numbers. Actually, this is the total confirmed cases. So if we were to look at new per day, and let's take the Europe out and the world out. So what was happening in Turkey here, that was really high numbers that time. And then as you can see, that number is slowing down. There was a 3-week shutdown. And then with the vaccination, I think that that's going to be really very well controlled, and that's at least my my projection. So now the other news that we have for you, just so that as we are getting safer with the vaccine, what's important to know is there's the new Delta variant, called Delta, and this is still infecting people even after the 2 doses. So they are suggesting that it's important to have a third shot or third dose as a booster, and that would be a good way to prep. If you got your second vaccine, let's say in April, in October you should have your third shot as a booster. That's pretty much what this is saying. And another news we have from United States is Novavax is another vaccine company that's coming out. Their clinical trial is almost done with the 90.4% efficacy. And this is similar to the BioNTech and Moderna. And hopefully it will be available. Now, before I start with this, so I'm going to give you a little heads up. Because Tanner is not here, so some of the PowerPoint slides may not be in the perfect order, but all of them are there. So if you see something randomly, don't panic, that's okay. So now I'm going to ask Susan Anderson and John Donnelly to join me. And John actually is not on the call yet. I don't know if he's looking for the link. So if one of you guys from in front of my office can check him. So while we are waiting for him, after long insisting, so Susan Anderson joined us. Susan is, and when I say this, I hope it doesn't sound in any way like the old tradition, or I don't want to sound sexist, or like, you know, how there's a woman behind every successful man. So she's the woman behind me. So, and this is true. So she's our Chief Operating Officer and Chief Financial Officer, and the second man in command in United Medical. So Susan, if you would like to introduce yourself, and then we'll start with a couple of the updates.
Good morning, Kemal. Thank you for having me. I hope you can hear me. First, I would like to say today is Juneteenth, which has been made a federal
Susan,
holiday.
I think your screen, your video is frozen.
It might be because I'm on Wi-Fi.
Oh yeah, that may. Are they able to get you on?
I don't think I have a wire in here.
Okay, so because right now, do you want to maybe turn it on and off once and then see if that's gonna
Video.
Mm.
Come back on.
So I think Susan didn't want to be on this because she is always worried about how she looks, but she kind of sabotaged herself. So I think your connection is slow. So if Alp or Anna from us, if they can reach out to IT, and then they can give you an extension for the for your internet.
Okay.
But we can talk while they are doing that. So so I'm assuming that they are listening. So of course, or Ethan, I know Ethan is listening.
So actually, while I'm adding this Wi-Fi password, I would like to say, I just would like to recognize that the federal government has named today a national holiday.
So Susan,
Yeah.
let's see if they are able to hear me. If I can get a message from someone, hold on.
Terry's going to go get them.
Okay, so while we are waiting for Susan's connection, in the meantime, I also don't have John on the Zoom signed in. So John is right next door. So John, if you are able to hear me. All right, so while we are waiting for them, I know that there are a bunch of people who are trying to get them. So the state of emergency is going to be lifted as of July 13th. So this modification signed Tuesday. So there are some changes, and let's see. There's a shot. So it's pretty much, if you are vaccinated, you are fine, but the state of emergency will be lifted.
Well, may I ask a question?
Sure.
To clarify what you were saying earlier about the boosters, are they recommending that anyone that has had their 2 shots should be getting a booster in 6 months after their second one?
Yes. The third, that's the booster as a third one. As a third one, that would be, that's what they are saying. That's correct.
I just wanted to clarify, just to make sure that I understood, so the rest of the world can.
So for fully vaccinated, after the second shot is 2 weeks. If someone is vaccinated, they got their second vaccine on, let's say, April 15th. As of April 30th, they would be fully vaccinated. So from that time, they are suggesting 6 months. And then there may be some new updates coming. So sometimes we give these updates, and then by the time we come back, some of them are changed. So, but that's why we are doing this weekly. So if there's anything new, then we would be sharing those with our patients and others. So now I see John was able to join us. Hey, John.
Hey, Kemal.
How are you doing? So this is not your first session, so they already know you, but if you would like to introduce yourself, please.
Yep, I'm the Director of Business Development here at United Medical.
So what does business development do? You made it sound like it was so simple.
Business development at United Medical has several roles. We also oversee the IT department, all of the data analytics, really the relationship with our main software partner, Cerner, as well as the sales and marketing.
Yeah, now that's not as simple anymore. So there are a lot of stuff happening in the business development. So especially for us, from the software to the services, training, sales, everything is going through the business development. What I would like to do, we have some updates. So I ask, and then someone helping Susan, by the way?
Yeah, I don't think we're going to be able to fix mine because it's on a Mac.
What's that?
I'm on a Mac.
Mm-hmm.
The cord that they came in with, it won't work for a Mac.
Okay, so then you're on the company Wi-Fi, right?
I am.
Okay, and do you want to try to turn the video on one more time, maybe?
Sure.
Okay, so I think this time it worked.
Okay.
All right, so now some of the stuff that I have is kind of like just for us to have some dialogue. So when I was going through some of these items that we had before, one of the things that we talk about is anti-competitive, anti-kickback, unfair business practices. So when I was looking for the state budget for 2021 last night, one of the things that I see, one of the updates that I saw is the unfair business practices bill passes the Senate and ready for governor's signature. So now, Susan, this is the discussion that we had with the Attorney General's office. I thought it was kind of similar. The only thing that wasn't there, I don't actually see how this is, if there was any concern for the healthcare part of it. So, now, like the way that I see it here is, it's more like the other businesses. If the unfair and deceptive business practice casts a shadow to undermine competition. So, the biggest problem that we have here. So I'm going to kind of, just point this out. So here, you see, when they cast a shadow on the reputable business, undermine competition and erode consumer confidence. So maybe because we are in healthcare, but my first reaction to this was, well, this is Christiana Hospital as the giant hospital, so they have the monopoly, and they are creating situations where I think this can be actually useful to have. So I'm not saying that they are doing anything illegal. They may be doing it with all the good intentions, but the way that it's affecting the business society is it's hurting us. Now, how it's hurting, and Susan, if you like to actually, maybe I was going to ask you, like, I know one of the issues, one of the departments that you are overseeing is the HR, and I know that hiring individuals from every level is always challenging, and many people don't really understand that. So when I see this, I was thinking that this is supposed to be helping businesses like us. If you can give us some background on what difficulties you are having, and then we can continue from there.
So one of the biggest challenges that we have in hiring quality staff is competing with the larger businesses. And the hospital in healthcare, hospitals are our largest competitor. And because of their profits, and which are driven by their fee schedule, a small business cannot compete with that. A solo practitioner, as an example, which we have several solo practitioners in our ACO, they cannot afford to pay $20, $23 an hour for medical staff, nor do we have access to affordable health care to provide to our employees. We pay a much higher rate for medical benefits than a large hospital system. So it's very difficult to compete with them for quality personnel.
Now, this is one issue is one part of the issue is from the support staff, like the medical assistants check in, check out. But I think you are also having difficulties even with the providers, physicians, NPs, and PAs, right? So it's affecting everyone pretty much.
It is. It definitely is. It's across the board. And even like from an ACO standpoint, the individual providers, the independent physician practices are finding it more and more difficult to stay in business. But we're looking to hire physician assistants and nurse practitioners. Their salary levels at the hospital are so much greater than ours. And what I have to really promote when I'm hiring is the quality of life that we're able to provide. That is the one thing that I'm able to provide.
And that's also true for providers, physicians, not to feel like they're just a number versus they really matter and they are relevant, and our setup does make that possible. Now, I was happy to see that update, and Susan was part of my meetings with the Attorney General's office. We had 2 meetings with them, explaining some of our concerns. Nothing specific for one organization, but overall, what practices are doing. When we lose the private practices, what would happen? And then some of the slides that I'm going to share with our audience is going to explain these a little bit better and why these concerns are important for all of us, not just for us. Just because we have business in healthcare doesn't mean that this is only important for us. We are all paying for this. So now what I want to do is, from what we are discussing, I do want to go to the state of Delaware's budget. Now, this was actually before maybe even start with this. Susan, you and I, we've been working together since 2001. For those Generation Z, some of you were not born yet, who are employed by us today. But it is 20 years. This is our 20th year. Now, 16 of this is under United Medical, and the 4 is under Blue Ox Medical. And the reason I'm mentioning that is because, and John joined us in 2010, but in 2008, I was asked to join the transition committee of Governor Markell. And when I was doing those meetings, and I was in the healthcare side of this, it was the health and social services. And Susan and I, we worked together for some of our individual meetings with some of the groups and understanding the budget, the state budget, and getting really familiar with how we spend money from the state standpoint. And this is why I wanted to actually bring that up today, and with the new numbers, but not much different from the percentage standpoint, how the state of Delaware is spending its money. So from the operating standpoint, what you see here is the big chunk actually is for public education. That's 35.8%. And health and social services is now at 27%. Now, we're gonna go with this guy here because it's kind of like our focus for today, and that's our industry. So now what I would like you to kind of see here is, Susan, you are, because your finance background is always, it's one of your strengths, but also your discipline in finance also makes us successful. Now, this from the expense side, this is what I see from the state of Delaware, but then their income is coming from mainly limited from personal income tax and corporate income tax. So this is, John, what's these two total? 28, let's say, let's call this 30. So this is about what, 62%?
Correct.
Okay, so 62% of this is coming from taxes. So the taxes are paid by us, all of us. John, I don't know if he pays taxes, but I do. I know Susan does. Well, John, because you have now 2 kids, I don't know if you stop paying taxes.
Don't worry.
Because I don't have any kids, I may be paying because of that, but I think that's not helping, right? So this is 62%, guys. Now, interesting enough, this abandoned properties and business groceries, so this is also business. Bank franchise and public utility. You see like how little these numbers are? Very little. Now, like I don't want to get into this one, but it's a big chunk for this group. So you won't see this in many other states. But let's just focus on our taxes. Now, this is also, can we just add this? So it's going to be actually 68%. So when the situation is this, where you get almost 70% of your income from taxes, and then you spend the money in, let's go back to that slide again. When you spend 27% of that in one chunk and the other 36% in the other. Now, everything we do in health and social services is important. So now let's look at, this is the one that, Susan, maybe you haven't seen before the update. This is, and this is what makes me kind of think of our transition of care, not transition of care, transition committee time, because I look at these numbers and wanted to see how the money is spent for health and social services. And the part of that is going to be Medicaid, right? Now, this is because they are from two different places, so I had to put them as two different diagrams, and I apologize for that. But from 2008 to 12, and then we have from 12 to 15 here. So perhaps I should just cut this, but that's fine. Now, Medicaid.
I'm so sorry, but I just noticed that they're spending less on education.
Well, they, from the percentage standpoint, yes. And then this is up to 2015, and I'm sure, I did some digging last night, and information is in different places, and it's not easy to just find right away. But what's really important here is something that started at 11.5%. In 2015, we are at almost 20%. It's almost doubling. So I just want to make sure that this is 8 and this is 2015. Now, this is why we are concerned about the healthcare costs, and this is why we are concerned about the hospitals overcharging. This is why we are concerned about, last week when I presented the hospital incomes for 2018 fiscal year for Christiana and Bay Health, when you put it together, it was 260 million net profit. 260 million just from two hospitals. Now, when you look at that kind of a number, and then you look at the state of Delaware's budget where we spend the most of the money, I think there is a big disconnect, and then people who are not really contributing are benefiting. And this is what we are trying to point out. That's kind of like our main goal for these sessions.
Plus, if I'm not mistaken, individual physician offices have not had increased fee schedules from Medicaid.
No, now the increase on Medicaid, this one is, earlier I was discussing with John, and he pointed out with the Affordable Care Act that we have more Medicaid. Yes, we were expecting more, but what it is that it comes with its cost, right? So the percentage of that 20% of Medicaid is how it's being spent is not all coming from the ACA extension. Now, how do I know that? Actually, you guys may remember from a couple weeks ago, there's a Medicaid newborn. The total expense is $2.2 million. Now, let's just put this in more like a real life perspective. So this is a new baby born on Medicaid, and before I think baby was 10, or John, do you remember? Is it 10 or 15 days old? It may be maybe 30 days, but the total cost in that specific month was $2.2 million. So where is that money spent? In the hospital. So now I'm not getting into was it necessary, was it not necessary? If it was, okay, so if it was my child, Medicaid was not going to pay $2.2 million, but the other thing is, it's the tough, sensitive issues. It is sensitive, but let me just say it in this way. What would I do? would I be able to spend 2.2 million on the healthcare expenses? My insurance would max out at 250,000. Then how would I actually afford paying the rest? Right? We will go bankrupt. Is that true?
Yeah.
Right? So that's the situation that we deal with. So accountability is not there, and politicians, they do try to make things better, but in many cases their understanding is also limited, and this is becoming more and more problematic for us and for the society that we live in. Now, another thing that we have is, we discussed before, the cost of our own employees' medical insurance from 10 years ago to today. That's double minimum. So 3 times. Okay, that's 300%. Now, John, as a young parent, him being a young parent with wife, and the family situation with, when you have a young family overall, you have kids, and then someone needs to take care of the kids, and in that time you lose income if both parents are working, and then you have more expenses. And I remember at some point it was like the family cost was extremely high, and it's still high.
Yeah.
But unless there is some adjustments are made or sacrifices are made, we wouldn't be able to afford those. And when that's the situation for real life for everyone else, when it's on Medicaid, we don't get to say that, oh, we'll just do whatever. No, we don't do whatever for us. I think the accountability and being accountable and being responsible should be implemented in the Medicaid program. Now, expansion is, yes, it's bringing its own cost, but in that expansion, can we actually control the increase of the total cost by decreasing the utilization, looking into the hospital fee schedules, and all that actually can still get us to a better point in terms of the total income and total expenses.
Yep.
So now we have a couple updates. We wanted to because our employees are also watching this, so from the individual succession standpoint, what United Medical does, and Susan wanted to share what we do with MJMA. So Susan, if you want to give some background on that.
Sure. At the end of 2017, we started talking about offering MJMA membership to all of our leadership team initially. And in 2018, myself and one of the other directors had 2 study groups, and we went through the process of, during company time, studying to test for the CMPE certification with MJMA. We believe that this adds value to employment here at United Medical. It's certainly for 2 of our, the first study team that we took through in 2018 of the study group that I worked with, I believe there were 8 or 9 of us, and 4 of us were able to achieve certification. And that certification, even for it allows for individuals that work here at United Medical to have a path of upward mobility, as well as if they leave here and go out into the community, it is a benefit to our community as well. So while, yes, obviously we have a personal, personal reason for wanting our members to achieve this certification, it benefits our entire community as well. It's a knowledge-based program. It covers operations, financial management, human resource management, risk and compliance, transformative healthcare delivery, and organizational governance. It is, I believe it is truly a good program for anyone in the healthcare industry.
Thank you, Susan. And this is, with the pandemic, it did actually kind of impacted what we were doing with the in-person meetings and other stuff. And if you remember, in the old days, we used to have retreats for our management team, and we kind of replaced that with the MJMA program to see if we can actually get the same outcome. And we had our Cerner health conference that we were going. This year, hopefully, we'll be able to go. And all those are affecting what we do with our employees, and we try to increase our communication and making it even more maybe stronger by having these sessions, including different individuals from the management team in these, and giving a lot of useful information. But I think the MJMA, the training of the healthcare is not there. So then, because there's no proper education for the healthcare management, I think when I go through that entire module system, it's the best way to kind of get a good, solid foundation in healthcare. And it's applicable for other businesses. It doesn't have to be just healthcare, because its main thing is the management part of it. Mm-hmm. So, I'm just looking at my other slides here, if we needed. Okay, so Nicole from our marketing team started to put these updates. These are patient survey shout-outs, and just wanted to share those. They're about, we get quite a bit responses, but of course we pick the best ones to share with you. So our goal is to make sure that we can, what we do is meaningful in a way that the service makes a difference in our patient's life. When they get that care, they feel special. And that's why we are sending survey requests for every visit, for every patient who are actively using our patient portal. So, and if you are not using the patient portal, you can still do the survey from our website. But I think the best way to do it is through the patient portal, so that makes it a lot easier. Now, there are a couple other stuff that we are going to come back next week. Now, the idea of state spending, state income, and our main focus of unfair business practices, high hospital cost, not properly being actually managed or controlled, or just the utilization standpoint, there is no filter. That is going to come back to us in higher taxes if we don't actually take each of us, each individual in the state of Delaware or in the United States or in Turkey, whatever is being spent is coming from us. The source of income for the state or the federal government is you. So whatever you are asking, you know that you shouldn't be asking because you are going to pay for it. So when it gets out of control, that's actually even more important for us to know and be more aware of those. Now, one last update that I have, this is coming up. This is the Highmark Delaware Medicare Advantage program, I believe. So we did sign this contract with Highmark for Medicare Advantage. I believe it's starting at end of this year. The open enrollment for Medicare should be October. So January 1, 2022, United Medical ACO providers are par with the Highmark's Medicare Advantage plan. So that's our last update. And all right, so now we had another session. It's supposed to be at 1. However, Dr. Erkan is in the hospital with the second case. He had 2 cases. So this is, Susan and John, I just want you guys to know, because I talked to him a lot with some of these issues. So he has 2 cases. The first one's supposed to be 7:30. It's at a hospital. And his second case started at 11:45. So the first one is done. There's a big gap in between. This is a surgeon, not able to do anything. And he just takes it. So he sits and takes it. So when we do it in our surgery center, we go from one case to the next, and the efficiency is our main focus. And this is why we also want our providers to feel like they're important. If my physician, my surgeon is wasting 2 hours for something that's already scheduled, just because from the hospital operations they're not able to run efficiently, that's why we are also we are advocating our private practices, our private ambulatory surgery centers. This is a waste of resource, waste of time, waste of energy. So now, having said that, that session is going to start at 2 p.m. In case, and we are going to talk about like, this is the morbid obesity with the bariatric program, and we are going to talk about sex. So if you want some details later on from Dr. Erkan and I sharing some of the research is done in the morbid obesity world, and some interesting stuff that's happening. We were focusing on mainly some comorbidities, some like from the well-being standpoint, but the big part of what it does, how it's affecting people's life, and patients with morbid obesity, what they are dealing with is not just the comorbidities, but also they are missing out on sex, and we are going to talk about that. So, well, thank you for being with me, and then we'll see you guys at 2 p.m. And Susan and John, thank you for being and joining this session. So I'll see you guys soon. Bye-bye.